Good evening, all. I'm Udati Lamba, coming to you from a remote location in New York City. Welcome to the Thursday night edition of South Asia News with Vision of Asia. This is our coronavirus pandemic report. A very sad day truly for America. Today, the number of deaths due to COVID-19 surpassed 100,000 in less than 4 months. Total number of cases in the United States is more than 1.7 million. We'd like to start the show by sending out condolences to all who have lost a loved one to this virus. Quite a sober time for this nation. House Speaker Nancy Pelosi today called for more testing to combat the novel virus and said that it is a sad time as we observe 100,000 deaths in the nation, and added that it is a scar that we couldn't save them. Globally, there are more than 5.7 million cases of coronavirus with at least 357,000 deaths. Top health officials today said that they are discussing a second wave of COVID while the nation continues to reopen. We cannot stress the importance of practicing social distancing right now and taking all the precautions recommended by officials and health experts all across the nation. If you are a South Asian on the front line or a member of community who wants to discuss their personal experience of COVID-19, please reach us on events@itvgold.com. Also reach us if you are a nonprofit participating in COVID relief efforts in India or here. We have tonight much on the ongoing contributions of Indian Americans for COVID-19 relief efforts and donations, along with more on New York City being the epicenter of this pandemic, featuring New York State Senator Sepúlveda. Here are the headlines. Senator Sepúlveda addresses South Asian American community on COVID-19, District 32nd, New York State Senate. Ajay Gupta on COVID-19 relief efforts helping India's underserved communities, England. Oak Tree Business Association distributes essential groceries to community, Oak Tree Road, New Jersey. This and much more right after a short break. Come back to us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. I'm Udati Lamba, and this is Vision of Asia, special report on coronavirus impact, measures, and updates. New York City, which is the epicenter of this pandemic, is now moving towards its phase one of reopening, according to Mayor Bill de Blasio, who said that this will begin in the first or second week of June, with estimated range of 200 to 400,000 workers returning back to work. What will this reopening mean for New York State, and how will it impact racial disparity, economic health crisis, and food insecurity? New York State Senator Luis Sepúlveda joined us for a virtual conversation discussing these ramifications of COVID-19 on New York. Giving his heartfelt condolences to all who are grieving, Senator Sepúlveda also urged all to contact his office if they need assistance and address the South Asian American community, saying that his district is there for all communities, and advised all on practicing social distancing and following the state guidelines of stay, stop, save, stay inside, stop the spread, and save lives. Here is Senator Sepúlveda on ITV Gold. That everyone has on their mind living in New York City is reopening. What is your personal take on it, and what is needed for you to reopen the state currently?
Well, thank you. That's a very good question. I may differ with some of my colleagues. I tend to be a lot more careful and conservative than most other people. I think if you ask me that statewide, and I dare say throughout most of the country, especially those 18 states where you're seeing a rise in infections,
Right.
I don't think that we are really prepared to open up the state, certainly not the city. For me, we need a lot more testing done than we've seen already. We need more tracing done throughout the city. And we need a lot more, PPEs, and we need people to follow social distancing rules. Essentially, we've seen that breaking down throughout the country. I mean, not just New York State, but throughout the country.
Right.
Over the Memorial Day weekend, you saw evidence of people at beaches. Social distancing rules went out the window. You see families, especially with small children, without masks, without practicing social distancing, without wearing gloves. And I'm very concerned about that. If you ask me, if we continue on the trajectory that we are going the last couple of weeks, I think there's going to be a second wave. It's going to hurt us. It's going to hurt the economy more than it already has.
Right.
So what I've been telling people is, please continue to take the necessary measures to stopping the spread of this virus, washing your hands, going out if only necessary. But some people are heeding the warning, many aren't. and I am extremely concerned about that.
Senator, we have lost so many, individuals to this disease, especially in the state of New York, in New York City. I would love for you to give a message out to all those that are grieving the loss of loved one, and also what is the state doing to assist these families right now, especially in New York State?
Sure. I mean, first of all, around my circle, for lack of a better term, I've lost about 23 people.
Oh, wow.
Um, Community activists, people that are like precinct councils and community boards, tenants associations. We had one TA president who was a friend who, a month and a half ago, we were together in a news story about still water, wasteful water in the back of a housing development. And they found him deceased in his home. He died alone without family. We saw the head of a precinct council, someone who didn't have any pre-existing conditions, who died suddenly. We saw a community leader in the Bangladeshi American community who passed away, who, he was one of the pillars of that area. So it's been terrible. And my heart, my condolences goes out to the families. It's so difficult to lose someone, especially when just a couple of months ago, this is something that was inconceivable. But it's part of everyday life now. The entire world has changed. And I don't see us going back to where we were before. But it's such a gut-wrenching experience to lose so many. And I really wish that, we can recover as a society, and any of those family members who've lost people. If they need my help, they can always reach out to my office. We're extremely helpful in any way. Now, on a legislative side or a policy side, one of the things that we did was we had HRA. We have legislation, myself and Assemblywoman Catalina Cruz from Jackson Heights, proposed legislation to increase the amount of monies that the city allows for funeral expenses. We increased it from $1,700 to $3,400. But one important element is that, in the area that Catalina represents in Jackson Heights, and certainly the area, there's a portion in my district, Starling Avenue, where we have a lot of undocumented immigrants.
Right.
People that are really essential workers that are at the forefront doing cleanings that no one else wants to do, putting their lives at risk. And because of their immigration status, they haven't had the dignity. Their families have not had the dignified burial for them because many of them just can't afford it. And since HRA doesn't permit undocumented immigrants to participate in this program, they were dying and the money wasn't there. So myself and Assemblywoman Cruz proposed legislation that increased the threshold amount that will be paid to help families cope with funeral expenses, but also to include undocumented immigrants. To some degree, HRA has done some of the things that we're proposing at the city level, but certainly want this to be statewide because so many people, especially immigrants and undocumented, are suffering and they don't have access to a lot of the safety nets that are being proposed throughout the state and the country.
Right, and directly related to that would be racial disparity and the impact of COVID-19, the economic crisis, the healthcare crisis on it. What do you have to say in terms of the racial disparity you've noticed personally in your district, as well as in the New York City itself? And when we're talking about these immigrant communities, how are we helping them right now? What are some of the resources they can, look out for to help themselves?
If there's something that this pandemic has highlighted or underscored, are the racial disparities that exist in our society, even in 2020. You'll see that in terms of economic stability, it is our communities, poor communities, Black and brown communities, that carry the load of many of these jobs. They can't afford to go and get on a plane to the Caribbean and stay there until this subsides. They have to work to support their families, and they're the ones that are at risk. We're talking about people that work in our subway systems, in our medical facilities, in our hospitals, people that clean our hospitals, people that have jobs that put them at risk. And so they have to maintain their jobs to survive. And yet, we haven't provided them with the kind of assistance that many of them need. If you look at the policing of social distance,
Right.
no matter how the commissioner tries to sanitize the numbers or tries to justify the numbers, something that he's tried to do time and again, the reality is there is a disparate treatment. in our communities as opposed to white and wealthy communities. Until recently, a lot of the backlash, of course, uh, led to a change in enforcing social distancing rules to the point where now the NYPD is leaving it to school safety officers and individuals that work with not-for-profits. But until recently, black and brown men and women were arrested, were brutalized, as evidenced by that video a few weeks ago. Were brutalized by the NYPD, and not all. I mean, I don't want to paint all of them with the same brush, because the NYPD also are essential workers who are putting themselves at risk.
In New Jersey, efforts to combat food insecurity and the economic impact of the coronavirus pandemic continues, where nonprofits and other associations are coming together to help the most vulnerable during these very tough times. This is happening when 1.2 million people in the state of New Jersey have filed for unemployment benefits due to job loss in this pandemic, and hence the issue of food insecurity is prevailing in the state. To combat hunger and provide resources for South Asian American businesses impacted by COVID-19, the Oak Tree Business Association recently distributed essential groceries to employees of businesses on Oak Tree Road in Edison and Islin. Through this distribution of essential groceries, the association hopes to help these families, ensuring that no one goes hungry. Here is the story.
My name is Bimal Joshi. I have a business on Oak Tree Road. This particular event is organized to help out the skilled worker and the worker of the Oak Tree Road businesses, to keep them here in the market because they are skilled and they have done a lot for our businesses. So we want to keep them here by providing them the groceries at least for the month. We are giving them like 22 pounds of wheat flour, oil, rice, cereal, milk, lentil, tur dal, moong dal, and couple of other stuff, so that they can at least survive and have the food till during this pandemic time, and people can stay home. Even we are distributing the mask and the sanitizer, so that way they can be safe, and we hope that they stay safe till this thing over.
Coming on your way. I just want to say thank you for the Business Association for setting this up today. I think it was a terrific event, terrific food pantry event, and it helps everyone on Oak Tree Road right now, especially the people that are working on Oak Tree Road. It's a nice community event. I'm glad that people from all over our community have gathered around this function to help in this time of need. So thank you everyone for hosting this. And this is Apna Bazaar, and Apna Bazaar has been a terrific asset and a terrific community leader in this community right now. For several weeks straight, almost 3 months straight, they've been delivering food, giving free food items to those in need.
I feel this is the time Oak Tree has come together. We have been together in a lot of fun events. We've been together in a lot of parties and socialize. This is the time when our town needs us, and we are needed by our people. So it gives me immense pride to say that all the business groups together of Oak Tree have come together to help and make sure that no person goes hungry, no one has the need, and we are providing to everybody. I must say salute to Khadak Singh ji. From 3 months he has been giving food to everybody. Just come and pick up your food and go. That takes a big heart. पैसे सबके पास हैं, business सबके पास है, but this is the time to give.
मैं हर परिवार को यहाँ पे ओक ट्री रोड पे पिछले 2 महीने की स्ट्रगल से, जिनके पास जॉब नहीं है, जिनके पास खाने की तकलीफ़ है, या जो बेचारे किसी भी सहायता के लिए एलिजिबल नहीं है, उनको हम किसी भी तरह का मोहताज नहीं होने दें। हम अपनी ओक ट्री बिज़नेस एसोसिएशन की तरफ से, जैसे बिमल दुआ जी, रवि महारानी फैशन से, मैं राज ज्वेल से, और मेरे ऐसे अपने हल्दीराम, बीकानेर वाले, ऑनेस्ट, ऐसे बहुत सारे परिवार, हमारा मिठास वाले कमल भाई जो आज उपस्थित नहीं हो सके, लेकिन उनका योगदान हमारे साथ हम कभी भूल नहीं सकते। सीमा जी हैं, रेडियो ज़िंदगी से सुनील हाली साहब हैं, उन सब ने सिर्फ एक अच्छा काम करने के लिए कोई डोनेट नहीं किया, बल्कि अपना समय भी योगदान दिया कि वो कोशिश करें कि उन परिवारों को कुछ ना कुछ पहुंच सके। तो मेरी आप सब से हाथ जोड़कर विनम्रता से रिक्वेस्ट है, सोशल डिस्टेंसिंग मेंटेन करते हुए हमने जिस तरह से यहाँ पे अपने साथ कोई ना कोई किसी परिवार के साथ जुड़ने की कोशिश की है। आप भी अपने लेवल पे किसी भी परिवार को जो सहायता की ज़रूरत हो, अपने तरीके से, ज़रूरी नहीं है कि आपने उनको राशन देके ही सहायता देनी है, शायद एक फ़ोन कॉल से करके उनका सिर्फ मनोबल ऊंचा कर सके तो वो कीजिए। और हम चाहते हैं कि इंडियंस ऑन ओक ट्री, लिटिल इंडिया ओक ट्री रोड, ओक ट्री बिजनेस एसोसिएशन जो एक बनी है, आपके साथ हर परिवार के साथ जुड़ सके, तब ताकि जब आने वाली दिवाली हो या ईद, जैसे जो आज सेलिब्रेट कर रहे हैं, आने वाली दिवाली इस कोविड फ्री, बिना किसी डर के हम यहाँ पे सेलिब्रेट कर सकें।
ये लिमिटेड स्टॉक है, सो आप दूसरों का भी ख्याल करें और प्लीज़ 6 फीट का डिस्टेंस मेंटेन रखें, जिससे ये हम जमा हुए हैं उसके लिए हमें ये कोविड का जो है वो हम ख्याल रख सकें। सेकंड बार जो फैमिली 2 बार ले रही हो, प्लीज़ मेरी रिक्वेस्ट है बाकियों का ख्याल रखें ताकि सबको थोड़ा थोड़ा मिल सके। प्लीज एक बार अगर आप ले चुके हो तो दूसरों की चिंता करें। सर आपने ले लिया।
It's time for a short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia, special report on the coronavirus pandemic, and I am Aditi Lamba. In India, the lockdown due to COVID-19 has seen several states witnessing millions of migrant laborers returning from the big cities to their hometowns, and the plight of these workers, at least 4.5 million of them, who have been impacted by the economic and healthcare ramifications of COVID-19. We're talking here about thousands of children, men and women left without work, food and shelter. Hence, non-profits and individuals from all across are raising funds and providing much aid to many underprivileged communities in India, Bangladesh, and other South Asian countries. Discussing non-profit activities now and COVID-19 relief efforts in Rishikesh and Rajasthan in India, Ajay Gupta joined us for a virtual conversation from England, detailing programs to help the most underserved communities, providing food and shelter. Ajay Gupta also urged Indians to consider giving back to the ones who truly need this help during this pandemic. Here is Ajay Gupta. But especially with the focus of these efforts on the countries, India and Bangladesh. So just starting out this interview with you, I'd just like to ask you, why was it so important to focus on countries such as India and Bangladesh? And, what is the level of disparity that you've noticed there that the need there was for a lot more relief efforts?
Yeah, so I mean, the majority of people that, a lot of the labor workers in India, they work to eat, right? So they work all day just so they have enough money to feed the family, and they do that day by day. So, when I spent a lot of time in India, I saw a lot of poverty, and even during, before COVID-19, there was a lot of families out there that are struggling to even provide one meal a day. One of the schools that I volunteer at, they bring kids from, very, very underprivileged backgrounds, and their parents literally send their kids to school knowing that they're going to get fed, because they don't get fed breakfast or they don't get fed dinner. Right? Some families have 3 or 4 kids and they have to choose which kid eats on that specific day. Right? Some kids, one kid will eat on a Tuesday, one kid will eat on a Wednesday. That's how dire some of the situations are. So if you add COVID-19 to the list, when Modi all of a sudden decided, we're going to, 4-hour lockdown, nobody can go to work, nobody can go back to their homes. What do? Right? When you barely have enough money for food prior to COVID, and then all of a sudden you have no money, people are left to starve. And, the same people that we were helping prior to COVID-19, those are the same people that we're helping again, and hundreds and thousands of more people around India.
Well, let's talk about Rishikesh, where you've done a lot of projects, as well as Rajasthan. We'll get to it in a little bit. What was the need on the ground prior to this pandemic that you were personally working with? And then when the pandemic hit those areas, how much of that need changed? And did you have to shut down your programs and sort of just focus on perhaps just feeding these families and making sure they had food and shelter?
Yeah, so prior to COVID-19, I spent a lot of time in Rishikesh, and we were raising money for the for the kids' education, and we medicine supplies, and just general all sorts of stuff that we needed to provide for these kids in the area. But as soon as COVID-19 hit, it's like, okay, we need to stop focusing on the education. Let's focus on what's the most important: food and shelter, right? So we noticed that there was a lot of families that live under the bridge, and a couple bridges in the Shisham Jari Kashmiri area in Rishikesh, they had no food, no clothes. Some of the kids had no clothes. So what we decided to do is not only did we provide them fresh meals every single day throughout COVID-19, but for the kids, we gave them, used clothing, shorts and t-shirts. And then we actually built shelters for some of these families under the bridge because, at the end of the day, if you don't have the basic things, what is the point in life? And we saw it firsthand that these families have literally nothing. Kids running around 3 and 4 years old with no clothes, no shoes, and a spoon with nothing in it. And, it was our responsibilities, our duty as human beings to really serve these people.
How much money did you have to raise in order to feed all these families? And exactly what was given to them? Are these dry groceries? Are these other meal packages that you're delivering on a daily basis? How is the entire program being run right now?
Sure. So we have a couple different programs. We have programs within programs that make fresh food every single day, right? So we distribute fresh meals every single day. We also have another program where we make baskets of food that can feed a family of 4 for 1 month. So one of the schools that I was volunteering at, there's 520 kids, all from very underprivileged backgrounds. And so what we did is we created a basket full of food. It had like atta, spices, oil, dal, everything that you need. We put all of that in a basket. It can feed a family of 4 for every single student and their entire family for 1 month.
What are some of the other organizations that you're working with? And also, if somebody wanted to contribute to these projects that we just discussed, how should they go about it?
Sure. So we have a GoFundMe page, and I'll send that link to you. And all that money is going to just the COVID-19 relief efforts. We also work with a couple other organizations. One is called godharmic.com. We actually just had an awareness call to raise money for them. Their goal is to provide 1 million meals. And as of this morning, they have 334,300 meals that they delivered all around India, in Punjab, Uttarakhand, Gujarat, Assam, Delhi, all around India. So that's another project that we're working with. And Sunday, just recently, 25 pounds, 2,500 rupees were donated to every single person that joined the call. And we raised 19,200 pounds within 45 minutes, which was outstanding.
That is pretty outstanding. Well, thank you so much for your time here on ITV Gold and discussing so much of your experience, on COVID-19 relief efforts. One last message to our audience and perhaps, a message on how we should be handling ourselves during this pandemic and perhaps giving back.
Yeah, it's before you help others, you have to help yourself first, right? Look after yourself mentally. We all will get through this, right? It's all a mental game, right? Think positively, wake up every single morning, have routines, have systems in place that set you up for success, juice every single day. COVID-19 is affecting those who, the most vulnerable people who are unhealthy and, who have compromised immune systems, right? So it's our duty to stay healthy, be healthy, so we can go out and, help our families and help other people all around the world.
And that is all for tonight's episode. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from a remote location in New York City. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.